I feel like a lot of people don't realize that they're not seeing perfectly, or that they're struggling up close, or they're struggling far away, when some glasses could make things a lot easier. In terms of eye disease, general eye exams can prevent glaucoma by identifying it early. We can also sometimes identify diabetic issues, and you can prevent other problems. If you're, say, a -6, say you're very nearsighted, you can't see much beyond right here. That affects your quality of life in a huge way. You can't drive. You can't even hardly watch TV without sitting right in front of it. So something as simple as a pair of glasses and a prescription for glasses can make an enormous difference. Also, people with cataracts, if you give them cataract surgery, they go from needing help with everyday tasks to being completely independent. Every day we give people glasses. It makes it so they can read, they can work better at their jobs, they can see better to drive, which is safer for everybody. People that we send for cataract surgery and we identify those issues early, they can have better quality of life for years versus not having cataract surgery and struggling with everything. One of the main things we do is we check for a bunch of things: glaucoma, cataracts, macular degeneration. Sometimes we'll be the first person to find diabetes. You don't really know what your eye pressure is. You can't feel it. Even if you have glaucoma, unless it's really high, you don't feel it at all. So we check it here and we see if you're at any risk of any problems. And there's things you don't realize. People will come in and they'll have some astigmatism and they'll say, wow, I didn't realize I could see this well. Or they'll come in and we'll say, oh, actually your pressures are really high in your eyes. Maybe we should do some more testing. And if you never went in, then you could start to have damage and not realize it. Getting an eye exam, I always say it's the easiest doctor to go to. We don't give you any shots. We shine some lights at you. We might puff some air in your eye. We might give you some drops. But really, we come in, you run a couple of pre-tests where we do the little puffer. We get a couple of measurements of the front of the eye. You come in here, we ask you which is better, 1 or 2, a few times, shine a couple bright lights at you, maybe dilate your eyes if you need it, and make sure everything looks healthy, and then we give you a prescription. So as an optometrist, I'm privileged to give the gift of sight to a lot of people, to give them the best possible glasses and improve their quality of life. I'm Dr. Alan Wiggins. I'm the optometrist here at Hunter Health. December is Gift of Sight Month, and we want to encourage everyone to get eye exams and have their eye health checked so that we can keep you as functional as we can.